are listening to Therapy Plus, a mental health podcast.
The views and opinions expressed by the guest speaker on this episode are solely those of the guest. The content shared is intended for informational purposes only and should not be construed as professional advice or endorsement.
Hello, my name is Dr. Christina Bjorndal, and I'm here to chat with you about naturopathic medicine and mental health. Naturopathic doctors are trained like medical doctors in terms of the sciences. We dissect cadavers, we study pharmacology, we just don't use drugs to treat. And what we use instead is nutrition, homeopathy, acupuncture, and traditional Chinese medicine, botanical medicine, hydrotherapy. We're also trained in massage therapy and chiropractic medicine and lifestyle medicine. We are guided by the principles first to treat the cause, which means we want to identify and remove the underlying causes of illness. Secondly, we don't want to do any harm. That goes without saying. Third principle is we want to treat the whole person by addressing the physical, mental, emotional, and spiritual aspects of health. We view ourselves as doctor, as teacher. We want to educate and encourage patients to take responsibility for their health. We are guided by the healing power of nature. We want to use natural therapies that encourage the body to heal itself. And the last principle is prevention. We put an emphasis on building health and using prevention as the best cure rather than fighting a disease or an anti-approach to health. So I haven't always been a naturopathic doctor, and I became one through my own struggles with my mental health. So these started back in high school, initially when I developed an eating disorder. But I want to emphasize here that actually this goes back further than that. I am adopted, and adoption is actually considered a trauma. It's a significant change for a child. So I learned that I was adopted at a young age, and I developed some beliefs around that essentially I wasn't worthy or wanted. And so that forced me to become an overachiever so that I would fit in, essentially, so that I wouldn't get sent back, so that my parents would be happy with me. And that served me very well until it didn't. And I kind of crashed and burned when I got to university. So I was hiding this eating disorder, which incidentally started shortly after I did a year of antibiotics to address acne. Now, that treatment of antibiotics for acne didn't actually address the root cause, and my acne simply returned when I finished taking those medications for that. So it wasn't the right approach for my health, and then subsequently the eating disorder, and then the spiral into depression and anxiety. And I was prescribed medication for that, which then left me in another place I'd never been before. A few months later, after taking the medication, I found myself in this other place. And that was, I wasn't sleeping. I was very euphoric. I was basically spinning out of control, unbeknownst to me, into a psychotic delusional state. That culminated in me having to be sedated and wrestled into a straitjacket by 6 people. And off I went to the rubber room and was hospitalized and given the diagnosis of bipolar disorder type 1. And so what I did with that is I wore it a little bit like a mask, if you will. Like that was not happening to me. Thank you very much. And I didn't accept that diagnosis one bit. I felt a lot of shame about it. And I continued marching through the world wearing the mask that, you know what, I've got it all together. But really on the inside, I didn't have it all together. And I was really struggling in particularly with this inner critic that was constantly berating me every step I took, telling me that I wasn't worth it, that I was pretty much destined to failure, essentially. So fast forward now several years, I've been now working in the corporate world, and then I had a suicide attempt that left me in a coma with kidney failure, and I was on dialysis, and I was told I would need a kidney transplant. It was a very extremely low point for me in my life. And so that led to what I refer to as a bit of a spiritual awakening for me, because I was at the lowest I could be. I was super, super not impressed when I came out of that coma that I was still here on the planet. I was really even more depressed than I had been prior to that. And I realized I needed to figure out another way to navigate my health. Taking the 5 psychotropic medications that I was taking simply wasn't cutting it. So here's the thing. I'm not anti-medication, but I am for them working. And in my case, they weren't. And I'm also for minimum dose for maximum benefit for the shortest duration of time. Listen, if you broke your leg and we put a cast on it for the bone to heal, are you going to wear that cast for the rest of your life? I would hope not. We need to look at medications through that same lens. So use them for the short term if you need a helping hand to get some stability in your life. But then let's fix these other areas that I address as a mental health naturopathic practitioner. So what are those areas? Well, just to round out my story, I ended up, as I said, I needed to figure out another way to navigate my health. So I ended up seeing a naturopathic doctor and an orthomolecularly trained psychiatrist named Abraham Hoffer, who was trained or worked with 2-time Nobel Prize winner Linus Pauling, who I quote, said, "Nearly all disease can be traced to a nutritional deficiency." So I started this protocol with Dr. Hoffer and with my naturopathic doctor, and I carried along the medication for a year together, both taking the treatment plan from these doctors I've mentioned. And I had my first year where I was free of depression and anxiety, which I had not had in the 15 years prior. And there I realized that I needed to, that there was something to this, and that I was really interested in learning more and making a career change. At that time, I reported to a CEO in the corporate world, and I really wasn't happy. I mean, I got a lot of fulfillment in some areas of my life in that corporate job I had, but ultimately I felt like it was kind of sucking the soul out of me. So I journaled for 1 year asking the question, if money didn't matter, what would I be doing with my life? And the answer that kept coming up consistently day after day was go back to school and become a naturopathic doctor. So that's what I did. I went back to high school at the age of 33 and became a naturopathic doctor. So here's the overview of what I explain to patients. There is 4 aspects to your health: physical, mental, emotional, and spiritual. Most practitioners are just operating on that physical level only. So, and you can go far with that, absolutely. However, if you don't look at the other 75% of the puzzle, the mental, emotional, spiritual pieces, you may run into continual mental health challenges. So in my opinion, it's important to look at all 4 aspects. But let's speak first to the physical piece. What I want you to understand there is there's 3 macro systems in your body. You have the neurotransmitters, you have your hormones, and you have your organs of detoxification. So it's my job as a clinician to figure out which macro system or systems I need to shore up in you to help support your mental health. So understand that it's not just about neurotransmitters. When we speak to those, there's 7 key ones that people are looking at: serotonin, GABA, dopamine, norepinephrine, epinephrine, glutamate, and acetylcholine. When it comes to depression and anxiety in particular, it's often the emphasis is on serotonin and GABA. When it comes to something like ADHD and psychosis, the emphasis is on dopamine and norepinephrine, epinephrine, and glutamate. So it's our job as clinicians to figure out, again, what are these root causes? What are the root macro systems that we got to support? And in my case, it was all three. Understand, speaking to the second macro system, your hormones, that every single hormone in your body, every single hormone, if it's out of balance, results in mental health symptoms. So the primary hormones people are aware of are estrogen, progesterone, testosterone, cortisol, DHEA, and our thyroid hormones. We want to then also understand that there is a gut-brain relationship, and your organs of detoxification, which includes your liver, kidneys, your colon, digestive system, i.e. your gut, lungs, skin, and lymphatic system, and immune system all also play a role in mental health. This is the idea of the brain on fire or inflammation. So this is another important area. And remember, I mentioned my mental health struggles with my eating disorder started after I took antibiotics. And there's lots of research out there that supports this gut-brain bidirectional relationship. So your digestive tract is a very important piece of the puzzle. So once we understand those three macro systems, the health house that we build involves 10 key steps. So the first foundational floor of your mental health house is nutrition, sleep, exercise, and stress management. The second level of your house, we're looking at your thoughts and your emotions, how you behave and react in the world, and your ability or your inability to set boundaries. The next level of your health house is the environmental perspective from three areas. Number one, genetics versus epigenetics. Understand that genes load the gun, but lifestyle pulls the trigger. So it's the epigenetic influence that is important, not whether or not you have the gene for it. Super important differentiation to understand. Second quality under the environment is the quality of the air, food, and water. Understand that there are chemicals in the air, in the food, and the water, and these chemicals can block receptors. So you might actually be making the neurotransmitters and the hormones. It might not be a manufacturing problem within you, but it's a blockage problem within you. They can't get in the door. They can't bind to the receptor of a cell and get in that cell and do the job they're supposed to do. And the third piece of the environment is this concept of neuroplasticity, in that the brain can change. There's a lovely book by a Canadian psychiatrist named Norman Doidge who wrote The Brain That Changes Itself. So this concept of brain plasticity or neuroplasticity means that we can create new neural pathways in our brain, and this can help us think in a different way and thereby feel differently emotionally. And so the key concept here is your brain is not static. It's not like it's this big lump of cement. It's got a more plastic quality. And then rounding out these 10 treatment areas, the last two is an emphasis in spirituality. So that's your house. Now we have to plant it on a property. And so we're going to plant your house on a property that's rooted and grounded and based in love. Everything comes down to that. So key questions to ask yourself right now on a scale of 1 to 10, how much do you love yourself? When I was recovering from my first suicide attempt, and I've had 3, but after that first one, I realized that I didn't love myself. And anyone who's struggling with suicidal ideation and with staying here with us on the planet, I can guarantee you they are not loving themselves, because it is the most unloving act to take your own life. And a similar but different question is, how much compassion do you have for yourself? So what's your level of self-compassion on a scale of 1 to 10, 10 being the best? Love and compassion for self is a necessary ingredient in recovery. Most patients are at war with themselves, and the inner critic is winning the battle in many of us. And it's my job as a clinician to stop that war with the self, to stop that battle within, and to guide patients to inner peace. So that's the overview. So let's just dive a little bit deeper into each of these 10 steps as given the time that we have. Let's just talk quickly about nutrition. So I've written a book called The Essential Diet, Eating for Mental Health. It is your eating roadmap to support the formation of neurotransmitters, hormones, and help with elimination and detoxification. This is the goal of the nutrition piece of the puzzle. We want to understand that you are what you eat. If you put garbage in your body, you're going to feel like garbage. And the car, i.e. your brain, isn't going to run if you don't put the right fuel in the tank. Understand that we want to investigate if you're missing essential nutrients or cofactors to form the neurotransmitters and hormones. These include tryptophan, phenylalanine, B3, B6, vitamin D, iron, magnesium, many, many nutrients. Chronic elevation of stress hormones can increase something called quinolinic acid in the body. So this means that you will not get to serotonin. Without going too far into the biochemistry, just understand that there's a relationship between your stress and your mental health. I already mentioned the receptors being blocked. That's something we have to investigate. We also have to look at what stage of life are you? Maybe you're starting menstruation. Maybe you've just given birth. Maybe you're hitting menopause or andropause in men. Hormones play a role in mood, as I've mentioned. Gut-brain axis, this concept of dysbiosis, which means a bacterial imbalance. Or if you're constipated, if you're not having a bowel movement every single day, you're constipated. This leads to inflammation, and that bacterial imbalance leads to mental health issues given the relationship between your digestive tract and your brain. So the foods that you can eat, what do we eat? So you want to eat and emphasize foods that are high in these essential amino acids. So when it comes to nutrition, there's basically 3 macro systems there too. So we've got protein, carbohydrates, and fats. And there's good and bad within all 3 of those categories. And most people's plates are heavy on the carbs, the wrong type of carbs, and heavy on protein and little on the vegetables. So your ideal plate, we want to emphasize, is approximately 50% vegetables, and then another quarter protein, and then another quarter healthy carbs. I know that there are a lot of nutritional information out there, from keto to paleo to the grapefruit diet to the South Beach eating plan to macrobiotics back in the 80s. There's the Atkins diet, which has been remodeled as really the paleo diet. There's vegan, there's carnivore. I mean, the whole nutrition industry itself feels like has bipolar disorder, to tell you the truth. So I'm pretty basic and I keep it simple. Partly because I have had an eating disorder. So you want to make sure that we're emphasizing these nutrients. Heavier on the veg, let's get that right protein in there, and definitely healthy fats, and a little bit of the complex carbs. So again, the essential diet is your roadmap if you want to check that out. But we also want to make sure that we're focusing on these therapeutic foods. So the foods that are high in B6. So this is going to be things like avocado, and there's B6 in chicken and turkey and halibut and brown rice and walnuts and beans. So you can look all these things up. And given that this is just a quick taste, we're going to just kind of hit the highlights here. So the other area I mentioned already is essential fats. Many people are eating saturated fats. So get rid of your fried foods. We don't want saturated fat. We want healthy, essential fatty acids. So remember, that keyword is essential. And when you hear that, what that means is you can't make it yourself. You've got to get it from your nutrition. We also want to support the liver and those organs of detoxification when we're eating. So the liver cleansing foods include things like beets and carrots, artichokes, lemon, parsnips, dandelion greens. So support your liver, and your fermented foods are going to help the gut microbiome. So those are foods to increase. And some foods we want to get rid of. We want to get rid of aspartame and artificial sweeteners. We want to get rid of or reduce alcohol and coffee and processed foods. Just shop around the perimeter of the store. You want to get rid of those saturated fats, like I mentioned. Sugar is another one. Huge, huge issue with sugar for people. Wheat, and then we want to consider whether there's a food allergy or sensitivity. So when I'm working with patients, this can be daunting, right? This can be really daunting, the nutrition piece. So I just say, look, increase one of the good foods that I've mentioned, and let's pick a quote unquote bad food that you can reduce in your diet. You have to do this gradually and be patient with the process. And again, if you're looking for a roadmap, check out the Essential Diet. Not only what you eat, but it's also how you're eating. You have two branches to your nervous system. Sympathetic, think stress, or parasympathetic, think relaxed. And digestion is a parasympathetic process. So many people are eating on the run, chomp, chomp, swallow, going through that drive-through and opening the bag and shoving it down our throats. That is not how it's meant to be. Digestion actually starts with the sense of smell when we're cooking our food. And the problem is in our society, we've become a fast food society. We're always on the run. We need to slow it down. And the key to digestion is to relax during meal times. If you experience symptoms like gas, bloating, heartburn, constipation, or diarrhea, or stomach pain, all of those are symptoms that you need to slow down. And yes, we need to investigate a little bit deeper if those problems are persistent in you, because they are or can be a root to your suffering. So when you eat, just eat. Don't talk on the phone. Don't watch TV. Don't read. Don't work. Don't eat on the run. Don't go through a drive-through and start eating while you're driving. Simply eat. You can engage in some lovely conversation if you like with your family. That would be nice, right? Think about how you want your meal times to be. So the next area that we're going to just tackle quickly here and the highlights is sleep. So sleep is a huge issue in our society, and it's a foundation of health. It's a precious commodity, and we need to guard it. In naturopathic medicine, every hour you sleep before midnight is considered to be worth more than 1 hour. And there is a relationship between the stress hormone cortisol and the sleep hormone melatonin. So very important in mental health. And now I understand when I was depressed, I would be getting 26 hours a day of sleep, right? And we all know there's only 24 hours in a day. So that just tells you that I was sleeping my life away. And on the flip side, when I had a psychotic event, I wouldn't be sleeping at all. So in my view, a key to maintaining health, whether you have bipolar disorder or depression or anxiety, is the sleep piece of the puzzle. And there's many things you can do to support your sleep. So if you go to my website, naturalterrain.com, and we'll put these links in the show notes here, I have suggestions for sleep. Check off what you're doing correctly and give yourself a pat on the back for that. But then, especially if you're not sleeping well, and there can be different issues with sleep, right? It could be you have a hard time falling asleep. It could be a hard time staying asleep, a hard time getting up in the morning, or all three. Depends on what's going on. We can support that. So just know that there's help available. I would be remiss if I didn't mention the role technology plays in sleep, and it doesn't play a good role. So the issues with technology, being on our phones, being on our iPads, computers, etc., is that the blue light affects melatonin, so suppresses melatonin, which we don't want. There's also electromagnetic frequencies that come from these devices that aren't helpful to us, and they can be stimulating. And again, what we're often doing on our devices is looking for dopamine hits, and that means we're really like addicts. And so we have to put our phones to bed before we go to bed. And this is what I do with my phone. And for your children under the age of 18 or even 25, because the brain is a developing organ still, right? Until we're 25, your kids need to be off these devices minimum 2 hours before they go to bed. And my preference would be that you do not give your child under the age of 16 any technology. But I mean, what planet am I living on, right? Not the planet that we have. So with exercise, this is another key area. I really leaned on exercise as a main pillar of my mental health until I blew out my knee and I fell into my last depressive episode. And this was in 2010. I actually blew out my knee twice, but the first time was 2010. And when I plummeted into a depression, I realized that I was very fragile in the sense that I had one stress and I couldn't use my coping mechanism, which is exercise. I was a runner, to give me those endorphins to help me feel good. And this also fed into my weight issues and my eating disorder as well. So it was a real eye-opener for me to understand that I need more eggs in my health basket than just leaning on one thing alone, one tool, which was exercise. Now, I'm not saying not to exercise. I am saying definitely exercise, but it shouldn't be the only thing we do to feel good. However, it does really help. So do what you can. The best forms of exercise are aerobic, and also resistance and strength training. And ideally, it's better to do with somebody. So community is really important. We need each other. So the only time I would not recommend exercise is with somebody with bipolar disorder or schizophrenia or who has a history of psychosis and they haven't slept for a couple of days. I wouldn't recommend exercising at that time. I've had 6 psychotic events in my life, and with the last one being in 2008. And one of them actually happened like a light switch when I was on a run with a friend. It totally took me off guard. I had been sleeping quite well. I had a couple of days of subpar sleep, 2 days, but I still had 5 or 6 hours in those nights. And it was a real surprise to me that happened. So anyways, if you want to learn more about my story, I've written another book called Beyond the Label, 10 Steps to Improve Your Mental Health with Naturopathic Medicine. That is the Bible for mental health my contribution to this space. And I highly encourage you to read it because it's going to go into way more detail than I have in this podcast. So please check out that book. It's available at your common online retailers and in Canada, Indigo, Chapters, Barnes & Noble, and of course, Amazon. The next area I just want to mention, so I managed my mental health quite well with the nutritional piece, the exercise piece, and the sleep piece. Those 3 things on the foundational level of the physical pillar of health got me very far in navigating my mental health until I had that fall and hurt my knee, as I mentioned. And then I realized that I had to look at how I manage stress. And I had to look at my thoughts and my emotions and my behavior and how I react. And so this is the second level of the health house I mentioned. Now, I just want to mention this so that you understand this key area. It's called psychoneuroimmunology. So this is a fancy word that means your thoughts create neuropeptides. Neuropeptides are chemical messengers that affect the hormones you produce. And those hormones you produce affect how you feel. So we have a little bit of a chicken and an egg problem here. Your thoughts affect your physiology. So for me, I had, as I mentioned, a very strong inner critic. And it was my naturopathic doctor who helped me navigate my thoughts, the world, the inner dialogue that was going on within me. This inner critic was constantly berating me, and I had to learn how to give some credit and voice to my inner cheerleader. And what you want to understand, as I mentioned earlier, there's 2 branches to your nervous system. So when you're thinking thoughts based in fear or stress, or that are the inner critic or inner bully or hurtful, you are going to drive this neuropeptide hormone connection to produce more cortisol, which is going to send the signal to your central nervous system in your brain that it's dangerous. And you're going to be stuck in stress and fear and anxiety and upset. Now, if you can be neutral with your thoughts or think something more supportive based on compassion and kindness, you're going to produce a different neuropeptide hormone cascade. And that in turn will help you feel different. So there's a few videos that I will share with you that is a process that I teach in terms of how to navigate our thoughts and create some awareness to the subconscious mind, which is running 90% of the show here, and which is kind of tucked beneath our conscious awareness sometimes. But when you can bring that into conscious awareness, you can change your thoughts. So when I first heard the quote, "Change your thoughts, change your life," I was so resistant to that idea that I think if you had said that to me, I would have rolled my eyes and walked out of the room. And I think it's because I felt like people were implying that I was intentionally causing myself to be depressed, kind of like they were blaming me for it. And I'm so grateful for my naturopathic doctor, whose name is Dr. Jason Hughes, who helped teach me how to navigate this inner world of emotions and thoughts. So the videos, there's 4 of them that you can download to help guide you through the process as well. And so that really was an important step for me, and really was one of the reasons I believe that I have remained stable since my last depression and psychotic event. So it's been 16 years actually, I guess it would be 17 now, right? We're in 2025. So for the psychosis piece, and 15 years since my last depression. So I do believe that you can get well. I don't subscribe to the theory that you are your diagnosis and that your only solution is to take medication for the rest of your life. I don't subscribe to that theory. I subscribe to the theory that you can get well when you address all 4 aspects of health: physical, mental, emotional, and spiritual. So I hope that you will look into these resources and that you have gained some insights into how you can support yourself with your mental health. My homework for you would be to pick one area, identify one area for yourself of the 10 that I mentioned: nutrition, sleep, exercise, managing stress by looking at your thoughts, your emotions, how you behave and react in the world, your ability to set boundaries, the environmental piece, compassion, spirituality, and love for self. So pick one area and make one change. Whether you're going to drink more water, you're going to have one less cup of coffee, you're going to put one less teaspoon of sugar in that coffee, whatever it is, you're going to go to bed a bit earlier, you're going to put your phone to bed at 8 o'clock at night. Just pick one thing. And then you will begin walking down the road of recovery, and pretty soon you'll be running down that road. So wishing you all the best.